Yes. Hiccups. We can also cause hiccups. I guess the diaphragm. Yeah, spasms. Positive pressure. All right, IPPB continues. Barotrauma. What is barotrauma? Positive pressure causes trauma to your lungs.
That's the trauma.
You caused it. You did it. When you hear barotrauma, you did it. How did you do?
Too much pressure.
Positive pressure. Patient's on a ventilator for a long time. Barotrauma, because you put too much pressure into somebody's lung. Pneumothorax. What is pneumothorax again?
Well, air in the cavity.
Yes. And how do you fix pneumothorax? Chest tube.
Just
Get that air out. Hyperventilation. You can give IPPB, and if you don't set it right, you can give them too much volume, and they hyperventilate. Means sit there and do that for 15 minutes. They really hyperventilate. So what happens when you hyperventilate? What's the symptoms? What's the symptoms of hyperventilation? It's on that NBRC exam thing I sent you.
Like we are hyperventilation. Yes, due to those faintness.
No, what's the symptoms?
Dizziness.
Short of breath.
too much rapid breathing.
Short of breath.
Come on, guy.
Think heart rate goes up.
Short of breath.
It's funny.
Tingling, lightheadedness.
Oh,
They'll be very lightheaded. They'll be going, I got lightheadedness and tingling of the fingers and things like that. And it's on the exam. One of the questions was, patient is taking a nebulizer treatment and patient complaining of lightheadedness and tingling of the fingers. And what could be the reason? What a respiratory therapist should do? The answer was like, change the dead nebulizer to Q4 hours instead of Q2 hours. Ask the patient to take nice, slow, deep breaths. The next one, ask the patient to pause in between every third breath. Yeah, I mean, you take a deep breath, you breathe, and pause. Meaning the patient just slow down pretty much with the breathe. That's what they're trying to get you to think. Please look at those questions that I send you, because it's extremely important. They ask these questions differently than what we ask you here. So you can get used to it, and if you guys are interested, I'll keep sending us. Otherwise, I will stop sending this because I'll waste my time doing all that work.
No, keep sending me.
Because, you know, if you learn IPPB and you see all the questions that NBRC asks you about IPPB, you get used to it by looking at it. But at the end of this, you know, when you go take the test, it'll be easy for you. That's why I'm doing that for you. But please look at it and answer it and send it to me. And if you got something wrong, I will explain it and send it back to you. Why you got that answer wrong and why this particular answer is right. I'll explain it with each one. Okay? All right, now. Hyperventilation, hemoptysis. We already talked about it. Gastric distension, air getting in the stomach. And decreased venous return. We already talked about that. Okay, go to the next one. All right. Before you start IPPB treatment, you need to calculate your ideal body weight. How do you calculate your ideal body weight? Everybody know how to do this?
Yes.
Okay. Thank God. This was the issue last year because we had to teach them this first. Since you know this, you're cool to go. So normal tidal volume range is 5 to 8 mLs per kilogram. Hyperinflation target is total volume times 2. Okay, let's say my ideal body weight is 60 kilograms. What is my normal total volume range? 60 times 8.
300 and 480.
Hmm?
300 to 480.
300 to what?
480.
480.
40.
That's the range. But how about the hyperinflation range?
Times 2.
300 plus 300, 600?
To 900.
Correct. 600 to 900. That will be my hyperinflation range.
600.
Okay, keep that in mind. Because when I do this IPPB, that's what I need to get, 600 to 900. Hyperinflation. Okay, all right, now, Bird Mark 7 is this IPPB machine. The name is Bird Mark 7. Okay. And this is a pneumatically driven machine, meaning this run off oxygen or air. It has no power connection. Only way to run this machine is 50 psi of pressure. You can have it with air or oxygen. Would you connect this to air if the patient require oxygen during the treatment? No, you would hook it up to oxygen. All right. And it can be time, pressure, or manually triggered. Pressure, and this is a pressure cycled machine. What is pressure cycled machine?
The machine, certain pressure, it kicks into the new.
Correct. The machine gives a breath, and the machine is looking for a certain pressure, and when it reaches to that pressure, it drops right off. Okay. On the side, there's a pressure gauge here. See if you can change this to like 7, 10, 15, 20, 40. It's up to 40. Okay, you increase and decrease the pressure. If I put it on 10, anytime I get that breath in, it goes up to 10 of pressure, then it goes into exhalation. If you have this set on 10, the machine does not go up to 20 and go into exhalation. It only goes up to 10. It limits the pressure at 10, and it goes into exhalation. So pressure cycled means you set the pressure, and the machine delivers the breath up to that little that set pressure and goes into exhalation. Volume cycled, like that machine in the back, that's a ventilator, and that's volume cycled machine. We don't set the pressure, we set the tidal volume. The machine looks for that tidal volume. Once it reaches that tidal volume, it goes into exhalation. So pressure cycled, volume cycled. This is pressure cycled machine. All right, and it can be used for short-term ventilatory support. You can use this machine as a ventilator. Primarily, we use it for IPPB therapy. Okay, now page 4. Now we get into some interesting facts. The first thing we want you to understand is the sensitivity. All right, if I have IPPB treatment, if I have to suck in on the machine, let me just show you.